The average length of a woman's menstrual cycle is 28 days, but this may vary between 21 to 35 days in different individuals. An irregular menstrual cycle is where the length of the cycle is outside the range of 21 to 35 days. This may be either less than 21 days, or more than 35 days. There are many causes for irregular periods. However, sometimes this may be a normal thing for a certain individual. Most common causes for irregular periods include the following. Early pregnancy. Pregnancy can cause missed periods or spotting. If you miss a period or notice changes in your period, you can take a pregnancy test at home, or see your doctor to find out if you're pregnant. Hormonal birth control. Hormonal birth control pills and hormone-containing intrauterine devices, or IUDs, can cause irregular bleeding. Birth control pills may cause spotting between periods and result in much lighter periods. An IUD may cause heavy bleeding. Breastfeeding. During the period of breastfeeding, the hormone prolactin level is high in mother's blood. Prolactin is a hormone that is responsible for milk production. Prolactin suppresses the secretion of reproductive hormones, resulting in very light periods or no periods at all. Perimenopause. Perimenopause is the transition phase before a woman enters menopause. It usually begins in 40s, but can occur earlier. Fluctuating estrogen levels during this time can cause your menstrual cycles to get longer or shorter. Polycystic ovary syndrome. Irregular periods are the most common sign of polycystic ovarian syndrome. If someone has polycystic ovarian syndrome, she may have missed periods, and heavy bleeding when she gets to her period. Thyroid problems. Hypothyroidism, or underactive thyroid, can cause longer, heavier periods and increased cramping. You may also experience fatigue, sensitivity to cold, and weight gain. High levels of thyroid hormones, which is seen in hyperthyroidism, can cause shorter, lighter periods. You may also experience sudden weight loss, anxiety and nervousness, and heart palpitations. Uterine fibroids. Fibroids are muscular tumors that develop in the wall of the uterus. Most fibroids are non-cancerous and may range in their size. Fibroids can cause your periods to be very painful and heavy enough to cause anemia. Endometriosis. Endometriosis affects 1 in 10 women of reproductive age. Endometriosis is a condition where the lining of the uterus grows outside the uterus, typically in the fallopian tubes. Endometriosis causes very painful, even debilitating menstrual cramps. Endometriosis also causes heavy bleeding, prolonged periods, and bleeding between periods. Obesity. Obesity is a known cause of menstrual irregularity. Rapid weight gain can also cause menstrual irregularities. Weight gain and irregular periods are common signs of polycystic ovarian syndrome and hypothyroidism, and should be evaluated by a healthcare professional. Extreme weight loss and eating disorders. Excessive or rapid weight loss can cause your period to stop. Not consuming enough calories can interfere with the production of the hormones needed for ovulation, most importantly estrogen. Excessive exercise. Intense or excessive exercise has been shown to interfere with the hormones responsible for menstruation. Female athletes and women who participate in intensive training and physical activities, such as ballet dancers, often develop amenorrhea, which is missed or stopped periods. Stress. Stress can interfere with a woman's menstrual cycle by temporarily interfering with the part of the brain that controls the hormones that regulate your cycle, which is known as the hypothalamus. Your periods should return to normal after your stress decreases. Medications. Certain medications can interfere with your menstrual cycle, including the following: hormone replacement therapy, anticoagulant medications, thyroid medications, epilepsy drugs, antidepressants, and chemotherapy drugs. So, what are the treatment options for irregular periods? Well, the treatment depends on what's causing your irregular periods and may require treating an underlying medical condition. Your doctor may recommend one or more of the following treatments: oral contraceptives, hormonal IUDs, thyroid medication, metformin, weight loss or weight gain, exercise. vitamin D supplements, and stress reduction activities. Thanks for watching. See you soon in the next video.